All right, just please be advised, we're going to record this work group as a public meeting and probably post some draft minutes after we're done. I'm going to go ahead. Aubriana, take it away.
Hey, well, good afternoon, everyone. Thank you for being here today and dedicating the time to go over this document. The original intent of this was through the EMS for Children program in partnership with other agencies at ADHS, just to provide a guideline or a resource for EMS providers when it comes to children and youth with special healthcare needs. When presented in Bureau meetings, it was recommended to format it in a training format. So I'm just here to meet with you all today to receive your recommendations on the document, as well as if we want to keep it in this document form or if we want to move it to a PowerPoint format, et cetera, et cetera. And as Shelley mentioned before, thank you all to that contributed and provided your recommendations prior to the meeting starting. So without further ado, we'll just get kicked off on some welcome and introductions. So if everyone would just want to introduce themselves, start with the EMSC team. So Adam, I'll kick it over to you.
Sure. Yeah. Hi. Thanks, everyone. I'm Adam. I know most of you, but I definitely help Aubriana with some of the EMSC tasks. And so thanks for setting us up, Aubrey.
Thank you, Adam. I'm going to kick it over to Jordana Carpenter.
I'm Jordana Carpenter. I am helping with EMSC as the Family Advisory Consultant. So that's it.
Thank you, Jordana. Dr. Woolridge.
Hello, my name is Dale. I'm a physician down here in Tucson, practice pediatrics and emergency medicine, and I chair the PACES committee, and I appreciate being involved.
Thank you, Dr. Woolridge. And Dr. Rice, hi.
Hi, good afternoon. I'm Dr. Rice. I chair the research or the education committee for the state.
Thank you, Dr. Rice. Keena McBee.
Good afternoon, Keena McBee. I'm the pre-hospital specialist for Banner Del Webb. I apologize. I have a terrible flu. I probably won't be speaking much. I've been there since July, but prior to that, I worked EMS for about 15 years.
Excellent. Well, thank you for being here today, Keena. And I hope you feel better soon. And I'll kick it over to Allison Lucas.
Hi, I'm Allison Lucas. I manage the Children and Youth with Special Healthcare Needs program at the Arizona Department of Health Services. And my program will be joined by Dawn Bailey, who's our family advisor, in a few minutes as well, but she's in another meeting, so she'll be coming in a little bit late. So I'll give her intro.
Thank you, Allison. Glenn Trainer.
Hi, everybody. My name is Glenn Trainer. I retired Phoenix Fire. Now I'm back with Phoenix Fire Civilian. Prior to that, I was a paramedic program director at Phoenix College, and then I've also worked as an RT on my days off, or if I have any days off.
Excellent. Well, thank you for taking the time to be here, Glenn. Deb Repke.
Deb, you're muted.
Yes, thank you. So I'm the executive director of Coyote Crisis Collaborative, which is the state disaster preparedness network. We focus on particularly mass casualty incident gaps in a region or across the state. And we have, we launched the National Pediatric Disaster Coalition and the Western Pediatric Preparedness Partnership, which has now been replaced by the two Centers for Pediatric Excellence. I think that's it.
Awesome. Thank you, Deb. Appreciate you being here as well. And last but not least, Shelley, I'm just going to have you introduce yourself and then we'll move to the next step.
Shelley Bissell with the Bureau of EMS. I'm a coordinator for all the meetings. Thank you.
Awesome. Thank you. So for the people that joined a little bit later, just to give some overview, this is the EMS, was originally intended to be EMS guidelines for children and youth with special healthcare needs, but was later recommended to be a training material. And so with that, I wanted to get feedback today on if we should keep it as more of a resource document for EMS providers to review, or if you would prefer it in a slide deck. And then once that's completed, I'll kick it over to Dr. Rice to go through the document. Yes, Allison?
Is there any reason it couldn't be in both formats? Like, I guess I can see a value to having it in both.
It can definitely be in both formats. I can tell you just because I do a ton of EMS education that if we post a resource document on the website, I don't think anyone will ever use it to create training or use it for anything. So I think if we want it to be utilized in any way, it has to be something that can just be delivered. So I think if we're not going to do a PowerPoint presentation, obviously the resource document would be helpful, but no one's going to use it in that format.
Yeah, and I would probably agree with that. Like, I also think the PowerPoint makes an awful lot of sense. And I also think just like a warm handoff of any resource makes sense and kind of like increases the possibility that folks will actually like get that information. Like, I just don't think I think about myself, like, who goes to some website and looks for, it's just a hard thing to do with time and whatever. Yeah, I guess I was only trying to think, is there a value in having it also in this format? Like, if you got the training, but then this would be like that resource document that you could keep somewhere and like refer back to if you needed to like remember something or just wanted to pull out some information from it quickly.
Yeah, you certainly could have both. I think that oftentimes in the way that this is written, I think it lends itself well to creating PowerPoint slide and using a lot of the text from within the document to put in the notes of the PowerPoint training, which helps on the instructor side for folks teaching this training who may not, have developed the training. Sometimes it's nice to have extra notes. So.
Okay, excellent. That's a great point, because that was my concern, is condensing all of this information into like, say, 1 or 2 slides. So I like your recommendation, Dr. Rice, of maybe putting the wording in for the notes and just having the presenter speak on behalf of that.
Can I ask for clarification, Amber, if you would? Yeah. You said you find it's only successful when we deliver it. Does that mean creating the event or providing
the PowerPoint? It's not useful to the EMS agent. They're not going to like print this out and hand it to providers. Like, they want something so that they can put it on their target solutions for a PEDS training or something like that. But they're not going to use it to create their own training. Probably no one's going to make that leap. So we have to make the training for them if we want them to use this information.
Got it. Yeah. So to answer your question earlier, Abriana, I like the concept of what I call a module, or even like almost like a toolkit, in which it's not only the educational slides, but it has the notes, and then there's an interactive component, which is very often required when it comes to CE related issues. So if we supplied those resources as a packet, an instructional packet, I think that would be beneficial, particularly for the smaller institutions.
Yeah.
I just misunderstood what you said earlier, Amber. Sorry.
Yeah. No.
Awesome. Thank you guys for that feedback. I will begin working on that. So I guess my next question would be then is, do we want to review all of the material within the guideline document first, see what we can cut, what we want to revise, and then go from there to making the PowerPoint and then eventually making the toolkit? How do we want to formulate the next steps?
Well, I think the easiest way to do this, so Abriana, who's controlling the screen? Is it you, Abriana?
I am.
Okay, so I think the easiest way to do this to start out would be, and I can start creating on my desktop separately, just the slide titles. I think if we kind of scroll through the document as we're reading through the document, which is how many pages again? It's
about 27, 25.
Yeah. So my thought is, as we start to scroll through the document, if those of you most involved in this can sort of decide what the slide titles are, I can start to create the shell of the presentation by just creating the slides, and then we can go back in and fill in the slides. And that way we start out with sort of an appropriate number of slides, and then we can kind of fill in from there. And then information that doesn't fit on the slide can go in the notes and be part of the rest of the resource documentation, as Dr. Woolridge had said.
Okay, excellent. Sounds like a good game plan to me. Anyone
Yeah.
else have any comments, questions, or concerns?
No. And whose slides are these? Are these yours, Aubriana?
Wonderful. Shelley provided these, so I figured this would be good, but
But these are blank.
yes.
Do we have that on the as an attachment or no? I didn't see this.
Amber, do you want to do a PowerPoint, or do you want to link to this slides one that you could edit? 'Cause
I can link to the slides, and then I can start just plugging in slides as Aubriana is going through the document, maybe online. Because I don't think we can look at both at the same time.
Let me get a sharing link. I pasted a link in there. I don't know what it is. I've been posting agendas. So anyone with a link can be editor. And here is that.
Okay. Let me see here. That's the second one. Okay, perfect. Okay, great. So I will start. I'm going to put this on a different screen. And Aubriana, if you want to start going through the document, and then I will start building the slide titles as we go through.
So I'm going to start with the first one. Thank you, Allison, for contributing to this, as well as Jordana. I know you both worked hard on this. So this is the original title that we had, Dr. Rice.
Okay.
And then you just want me to keep scrolling, is that correct?
So maybe we have who are children with special healthcare needs. Is that who we want to start with? Maybe as a first slide.
Yeah, I agree.
Okay, so our first slide is going to be who are these children?
Okay.
And then, okay. And then you guys tell me when you see something else you think needs to be a slide.
Okay, Allison and Jordana, since you're a family representative side of things, did you want to combine parents and caretakers as partners and the general guidelines together, or do you want those individual slides?
I would say individual because it's different.
I would too. And I think that one of the conversations we had when we were looking through it was that we really wanted to lift up that with these kids, like the parents really are experts a lot of their time in their clinical care, and that they get a lot of like home health care. And so to really just like make sure that that's right front and center to use that resource.
Okay, so I think we're going to be at a max of how long do we want this training? 30 minutes? So we got to think, we want to keep it like 30 slides?
Yeah, maybe. I mean, do you know like what is like a standard slot of time that
for like a
have for
7-minute training, we usually try to keep them around 30 minutes, but
yeah, so then that makes sense to me.
Okay.
I mean, I think you could say something like, well, I guess the whole training is general guidelines, I guess general and then specific guidelines for training kids.
Aubriana?
Instead of maybe for the parents and caretakers slide, maybe we just have that be like at the title portion, kind of like what we did for Safe Sleep, like the ABCs for the thing, always refer to the caretaker or parent first. Is that okay? No.
I am thinking you could put it on that side of who are children and youth with special health care needs. And then I think it does get reiterated like throughout the training anyway. Like I think it gets reiterated throughout this document. So it would be like, these are who the kids are, and remember in the care for these kids, like always look to the parent or caregiver, and then going into the general I mean, then going into all the guidelines. Do we have a link to that document? Sorry, I obviously have read through it, but it was a long time ago now. Just
Which document?
the one that Abriana has opened, the actual.
It should be in that invite in the meeting.
Oh, is it? Okay.
Yeah. Trying to look at two things on my screen at once here. Okay. So I'm going to look at the titles really quick. So if we look at the table of contents, we have important considerations. And so maybe this is 2 slides. So who are children with special health care needs, and what do we think the other slide in here is?
Yeah, and I think if you had those 2 important consideration slides, then that's where that one would obviously fit in easily, like important considerations, starting with ask the parents, caregivers.
Although it looks like I have a different document. The attachment I have does not have all this stuff.
Oh, so this one, Dr. Rice and Allison, is going to be the attachment. I believe Shelley added a link for us. It's going to be, where is it? This link right here on your invitation.
All right, hold on. I'm looking at a different version then of it. I have.
Apologies. All the updated ones were added in a separate.
The one that says proposed changes, that one?
Nope. In the attachment, it should say section 1 suggestion for important considerations, but I can also add.
I just dropped it in the chat, Dr. Rice.
Thank you.
I found it.
Okay.
It's a different one though. Okay. All right, so. Okay, so we have who are children with special health care needs.
Yep.
And then the next slide. Oops. Was. So you have stuff in here about parents, general guidelines, underlying medical conditions, medical history, equipment, go bag.
The go bag, I think, is going to be important just because I know from being in certain rooms that some people aren't aware of the go bags. So go bags, I think, could go on the first slide.
Maybe that should be towards the end when we talk about transporting them.
Okay.
Maybe.
So should we do 3 slides then for this so that it's like separated by 1 and 2, section 1 and 2, and then you have section 3, which has a bulk of information. And then 4 through 6 be at the 3rd slide.
I think each of those subheadings almost is a slide, Abriana. I think Dr. Rice was saying we could do like up to 30 slides if we were kind of blowing through it in a 30-minute presentation.
Yeah, but it depends on, do you want the bulk of your slides to be like a generalization about kids with special health care needs, or do you want all the detailed information about the different conditions?
I think just for this one, it's providing like a high level overview. So
So are we not including any of the stuff that's emergencies involving trachs, indwelling central lines?
That would be a separate slide. Yeah.
Right, but that's all going in this PowerPoint as well.
I'm sorry, Dr. Rice. I don't know if I'm following the question. Would you mind reiterating it? I apologize.
Sure. So we have this document, which is important considerations, but then we have this whole other document, which is 25 pages about tracheostomies, hemodialysis lines, urine, all of that needs to be in this PowerPoint, right?
Yes, that's correct.
Okay.
These separate documents are just revisions that people recommended before. So the section 1 attachment and section 2 in the invite are suggested recommendations from the work group.
Okay.
From the original document.
So I have a slide that says children with special health care needs. So who are they? And then parents and caretakers. Underlying medical conditions and baseline vitals. Does that need to be a whole separate slide?
I think maybe because it kind of level sets that like baseline for these kids might look really different than like that, unless they know what these kids' baseline is, it's going to be hard to know if they're
Okay.
off their normal. If
Okay.
that makes sense.
So slide about baseline vitals and then medical history. So slide about taking.
Baseline vitals and medical history could maybe be combined.
I don't think so. There's a
No,
lot of-
okay.
And then equipment. We can always move some of these. New slide, equipment. And then another new slide. Go bag. Okay. And then transport and facility selection. These may end up getting moved to the end, but I'm going to just make them so we have them. Okay. So that's this document.
Yes, so that's section 1, and then Glenn was kind enough to provide recommendations for section 2, which is the respiratory distress in child with a trach tube.
Okay. So this next one will be, so this next section is going to be
Yes,
I saw
Deb?
the hand.
So this goes up a little bit, but it's on the movement of the access and functional needs children, and I wish Don were on. But what we have found is that, and I have checked with the Arizona Healthcare Association, which is long-term care association for Arizona, with the nursing homes and so forth. But if a child is, I know that they would like to go home, but if they aren't needed, if it isn't to the level of should be transported to a hospital, especially in a mass casualty incident, then the choice can be to go to a nursing home. And they can accommodate and take care of the child so that it frees up the space for a hospital.
Yeah, our providers generally cannot take children or any patient to anywhere other than an ER.
Okay, what if it's a mass casualty incident and the hospital is already on divert or?
So that would be like a one-off situation, and it would have to always be dictated by hospital and fire department leadership on the scene of a mass casualty on where those patients would go. So yes, that would be determined, but we would never predetermine that.
Right, that's perfect. I'll talk to the fire chiefs. Thanks.
Yeah. Yeah, they have a process in place for how they manage mass casualties, and it's all departmental emergent and like hospital and city emergency management procedures.
Right, perfect. Thank you.
Yeah. Okay, so I have, moving into our next section.
Can I interrupt? And I'm sorry. I'm having a hard time tracking. Are you guys working in a secondary document right now?
I'm just creating the slide titles as we go down.
Okay, got it.
And so we can't see both, but all I'm doing is trying to figure out what slides we want, what slides we want. And so we can build the slide deck, and then we can, because I don't know if we'll have time in this hour to get through more than that. And then maybe the folks from the PACES group can help fill in the content of the slides once we decide what slides we want.
Okay, all right. And you're longitudinally following the text,
Yeah.
the text here. Okay, got it.
Yeah. And then once we get to the bottom, then we can flip over to my screen and I can show you the slides.
Okay, thank you.
Yeah. Thanks, Dale. Okay, so our first medical topic is this respiratory distress in the child with the trach tube. Looking through this, Aubriana, are you scrolling on yours too?
Yes.
Okay. I'm trying to look at 3 different screens. So like ABC stuff, we're not necessarily going to do. So we're going to have probably assess the trach tube, suction. So how many slides is this going to be? This looks like a lot of information.
Dr. Rice, I apologize. So I apologize to everyone in the work group for the confusion, but we're going off of the section 2 document from what Glenn Trainer recommended. That was in the attachments.
Which attachments?
It's, let me put it
Like
in.
5G? I'm
Sorry.
on 5G.
This one this is just specifically section 2. So then after this, we'll go over to the main document that was on the agenda.
Okay, so let me just look at your screen then for section 2. Because I obviously don't have the same one. Okay. So they would generally know about someone with a trach tube. So causes of respiratory distress with a trach tube.
Glenn, if you have any feedback, feel free to come off mute. If not, it's okay.
Of course. So I think for each subsection, like there's a main title, and then so the second one should be like a subtitle leading into each one of those bullet points is just A, B, and C. I try to make this as minimal as possible because I know it's probably going to turn into a PowerPoint. And then other bullet points would be like an example. So slide 2 of this presentation, not including the subtitle. So A would be one slide. We got to be able to identify signs of respiratory distress.
Right.
Okay. You can go and do a bunch of bullet points. That could be the title, bunch of bullet points of those are them. And then B would be another title for a slide. And then you don't have to put each one of those. They can just be talking points. These are some ventilation issues, little notes page and say airway resistance, And then so you don't have to put all of these in there because it's just on PowerPoints, it's just too much, too busy. And then so you can do 3 bullet points here, ventilation issues, oxygenation issues, tracheostomy tube issues. And then you can just talk about, once you get to those bullet points, an example, tracheostomy tube issues would be, we can have obstructions like mucus, thick mucus, bleeding because they're brand new tracheostomy tubes. Somehow they made it home, or they can get dislodged. And then that's it. And then move on to the next slide, airway management. So I try to make it as easy as possible so it'd be transfer over to a PowerPoint.
Cool. So if we are doing this much information in our slides, this will be, looking at the number of topics we have, this will be 80 slides. So I think the first decision we have to make is, do we want to break this up into several different more in-depth educational trainings? Or is this this is how you take care of children with special healthcare needs, and we're going to give you the main things you need to know in a 30 to 45 minute talk?
So as I was going over all of these the packet, I think that just to try to go through all of this in one day of training. This is a 1 day plus training. My suggestion would be like children with healthcare special needs, respiratory distress, children with just different ones. And now we have a bunch of little topics that we can talk about. So, and then it doesn't make it as long, and it actually makes it enjoyable training rather than 80 something plus slides. So then you can just pick and choose. So not everybody wants to learn about PEG tubes that day. So let's just talk about, so somebody might want to learn about just trach tubes. You know what I mean? So you can pick. So I feel like if you can just create a bunch of trainings out of this, and then the overall header or title would be what your initial title page was.
So who are these trainings mostly going to be aimed at? Who is our target audience for these trainings?
The EMS provider was our original thought.
Right, so the general paramedic though, these aren't community paramedics or any specialty paramedic. We're just talking about the general paramedic going on a 911 call to a child.
For now, yes. Eventually we'd like to do like the critical care endorsed paramedic as well.
Sure, sure. So I think that very much of this information is applicable on the critical care side. I think much less of it is going to be absorbed by the general EMS practitioner. If we are doing these big, long presentations. My fear is if we create 4 hours of special healthcare needs training, that no one will have the time in their training schedule to take 4 hours of training just on children with special healthcare needs. So I don't know what others think in the group. I think it's a very narrow audience that would take this much training on special healthcare needs. So do we want to create a training that's likely that would apply to anyone in the field, would give them the information that's most important that will help them take care of some of the more common issues we see in the field? Or are we really drilling down to that very few number of paramedics that are going to be really taking care of these types of children? That's sort of like the first question I have.
Well, I mean, I'll give my 2 cents if you guys don't mind. I'm kind of with you, Amber. I think practically speaking, having a module that'll apply to everybody to give kind of an overview would be really good. It would be nice to have that extended and even linked to sub-trainings.
Mhm.
And the EIIC has tons of prepared and non-proprietary things that can be linked to that when
Yeah.
it comes to some of the detailed information about G-tubes or tracheostomy
Mhm.
tubes,
Mhm.
medical supplies.
Mhm.
So I think a general nice and tight, focused slide presentation to a general audience would be very helpful. But then at some point, either as secondary work, offer them the additional details for those who would seek that.
Yeah, because I think we have to think about the audience. I don't know any agency that I do medical direction for that would do this much training on children with special healthcare needs. They would take a training that's a 30 to 60-minute training. I would certainly say that that's super valuable to say, these are some really great things that are really important pearls, things that we really think you should know about children with special healthcare needs. I would never get our training group to allow us to give 4 hours of EMS training on this. Unless they were like a critical care paramedic or someone that needs this level of detail. Yeah, Brianna.
Awesome. I think I just saw Jordana come off mute, so I don't want to interrupt. Jordana, did you have anything to say?
No, go ahead. I'll comment after.
Okay. Well, I thank you both very much for your feedback on that. I will just say that one of our reasons for initially starting this was through our EIIC, EMSC state partners, federal partners. They do have those resources at the national level, but they do advise us to have them at the state level too, just for reference for providers. In addition to this, when we were at a conference, we did have a specific request from an agency and followed by another agency agreeing that they would like to see more of this information, which is what really propelled us to do this in the first place. So I just want to provide that context for one of the reasons why we came up with this.
Yeah.
Sense of
Yeah, I think that the topic is super valuable, and Jordana had something to say too, so I'll let Jordana weigh in.
I think every provider, regardless of what position you're in, needs to have this clarification as to what we need to do with our children who have special health care needs. Whether they run on them every day or once a month or once every 6 months, they still need to have this education so that they have a better understanding, because each interaction can be very detrimental if they don't understand.
Yeah, no, I totally agree, Jordana. I think that a lot of our agencies have very limited EMS training time. And if we create something that's too big, then my fear is it won't get used at all or very little versus providing something that's more likely to be picked up and used much more broadly, which is generally the aim of the education committee. We put out mostly things that are broadly applicable to all EMS groups, not just subspecialty types of providers. So I do want to make sure that we keep it focused enough that we're providing good information without going too in depth for the general EMS practitioner.
And this is Dale. And please, I'm hoping I wasn't misunderstood earlier. I'm not saying this shouldn't be brought. I'm saying maybe it's more prudent to start with the general module and then start working at the sub-modules that can be linked. And again, the EIC non-proprietary can be linked very easily in Brockton, Arizona. That's all shared through the state partnership grant. But starting with the general for everybody to use, and then let's start getting into the weeds.
Yeah, I think that would be great. I think it would be lovely to have that resource that we're trying to create. I think as an education committee content, though, I don't think the education committee would pass through a teaching module that was more than 30 to 45 minutes total.
This is very helpful feedback. Thank you both. And that's really what we were hoping to have with this discussion today in work group, just to see what we can do with this document. And I like the idea of starting with a broader spectrum and then focusing in on like each specific topic. Is that correct in my understanding?
Yeah, I think if that's what you guys want to do, I think we can work for the initial education committee on what's our initial sort of like for everybody training. And then maybe we talk through how we assign out, kind of like you guys have already started, like assign out and say, why don't you draft this one? Why don't you draft this one? Why don't you draft this one? And folks can come with a draft of some of these other more in-depth modules.
Okay, I'm gonna defer to anyone else in the group. Do you have any questions, comments, concerns? Anyone from Bureau of Women, Children's Health or Glenn? Yes.
No, I think you guys are right on it. Like Dr. Dale said, a brief overview and then a bunch of little subtopics later on. If you want to dive deeper into these types of emergencies or problems that we may interact with, and I think this is the way to go. Honestly, I don't mind helping with that either.
Yeah, and I would also agree that my highest priority would be on making sure that we get that base level of knowledge to the most people, and some of those really general guidelines. But I did want to kind of second Jordana's concern that I do worry that because we have such a like low incidence but really high risk population, if there's a way to make sure that we kind of weave into this training that like this is everybody's problem, like this isn't just a specialized thing, like these kids are in your community, you might be on a call, like how to, I don't know, maybe we could put in some of the, I don't remember Abriana or Jordana, if some of that guidance was in there about like how do you be proactive about knowing if there's kids that you might serve that have something, have like how to make sure that you have that information before the emergency happens, who could be in your service area that's coming into these categories.
Yeah, exactly. I think that's the kind of stuff, like we ran into this issue when we created the fall training, right? So there's so much you can go into with fall prevention and home safety evaluations and all kinds of stuff that technically providers are capable of doing. Generally, that's not going to happen at the EMS level. And so I think what we want to make sure that we put out there is how do you recognize that there's a child with a special healthcare need, an awareness of the different types of healthcare needs that children might have that require special attention. making sure they understand, just like an LVAD patient, that parents and their providers are very knowledgeable and more knowledgeable than anybody else about their child's condition, things so that they don't feel surprised when they come on the scene and they see something they're not expecting to see. I don't know if I'll ever get a paramedic to be comfortable helping to do a trach exchange or those types of things on scene. I think those things are very challenging to educate on. I mean, they don't see them a lot. So yeah, I agree that it would be great if they all knew how to do all that stuff. But I think that what we really want to get across, probably, it seems like, is how do we recognize these things, and who do we look to provide us the information to help take care of the child, and where do we need to take them? I think are the most important things. Kina.
And so with what you just said, I think that's where having this in both formats, like a training format as well as a reference, and that being distributed so that there is a quick reference for EMS to go to that isn't a PowerPoint, where they can just kind of pull something up off the computer and have access to that extra information.
Yeah, totally.
Okay, awesome. So I think my original plan was just kind of keep it with these maybe 9 title slides. Before any revisions were done, my plan was to just have like the high level overviews, and then it goes into the details of how to provide that care. So for each title slide, maybe we could just like focus on the 3 top bullet points within the initial resource document, and that can act as our overarching guide for EMS provider training. Does that work?
So I'm trying to look at that document again.
Yes, and I apologize, Dr. Rice. I keep jumping back and
No,
forth.
that's okay.
For everyone else, this is the original document in the agenda.
So right now I have children with special health care needs, parents and caretakers, information about baseline vitals, which I think is really helpful, gathering the appropriate medical history. I'm not sure what's in the equipment section, but there might be something in there. And I have something about a go bag and where to transport to. And then you're suggesting, Aubriana, a slide about like tracheostomies in children.
Yeah, so just like a high level overview of all of these different emergencies, which is what's kind of in the original document. These ones are more the suggestions that we received from Glenn and Allison.
Yeah.
But they're more in detail. So I like section 1, but section 2 would be good training on its own, I believe.
So
I don't know,
tracheostomy, and then what were the other ones on there?
There is indwelling central lines.
So indwelling lines, so lines. Feeding tubes would be a good one. These could be probably like a few each. I don't know about apnea monitors. They're not going to do much with those. A VP shunt. What do we think? I think those are important because I think that the things that I worry about with children with special health care needs are them not recognizing that a VP shunt is a big deal. And a child with vomiting with a VP shunt is very different than a child with vomiting that doesn't have a VP shunt. So I think it's those sorts of things, and teaching them to recognize the things that could be really wrong with a kid that they don't really understand the background medical nature behind, right? So VP shunt to me is an important one. Central lines, I think, are important. Feeding tubes. I don't know what's in the apnea monitor section.
Would you like me to scroll down to that, Dr. Rice?
I'm kind of urinary drainage cath. That's just like a Foley catheter. Hemodialysis lines. Peritoneal dialysis. Okay, what do you guys think? Is there any more you would add on? Right now for this one I have tracheostomies, indwelling lines, feeding tubes, and VP shunts.
The only one I wondered is the emergencies involving neurodiverse children,
I-
only because
that
it's
was-
probably a high
That was
incident one.
the other one I was thinking of adding. Yeah,
Because it does just have kind of some practical stuff around.
yeah, I think that was the other one I thought would be helpful as well.
I think gastric and urinary catheters can be combined in that the infield emergency is really just maintaining their stability until you get them to care. If you wanted to consider those two.
So gastric and urinary catheters.
Yeah. And the management, the devices are similar and they're usually sequestered with a balloon in both accounts.
Yeah. I think colostomy bags, pacemakers. What about ventilators? Children on ventilators. I don't know that it's different than what they would normally do.
No, I think internalized pacemakers and ventilators are common. I mean, the settings are clearly different,
Yeah.
but there's commonality with other patient populations.
Yeah. I'm trying to think of what I know that the times that it's come up for us, they normally will call if they're unsure about the ventilator settings, they'll call, the base hospital and confirm the ventilator settings before they transport a kid on a ventilator. The rest of the troubleshooting would be the same.
I laugh at that, Amber, because it's usually the guardian that knows a lot more than the emergency doc does.
A lot of times they do. Sometimes it's actually the sending facility that calls.
Right, yeah.
With the rural hospital that isn't sure. Jordana, go ahead.
So are we just picking and choosing from this document certain things, or are we going to acknowledge all of it? Like, I'm a little confused as to what we're doing here now.
So for the general EMS provider, we're putting in the topics here that the general EMS provider might not already know about in children.
Okay.
But things like colostomy bags and stuff like that, there wouldn't be anything they would do with a child in the field with a colostomy bag that they wouldn't do with an adult. They're not going to touch a colostomy bag regardless in the field.
Correct. Okay.
So I for the general training, we left that one out.
And Dr. Rice, just for like the flow of the training, I was wondering if that slide number 7, the equipment, that kind of general equipment piece would come before this. Like you could kind of give that general equipment piece, which I think had something about like, that seemed important, like treat the kid, not the equipment. Like don't get so caught up in trying to fix some broken equipment that you're not taking care of the patient.
Yeah, exactly.
And then go into some of those like more detailed equipment things.
Yeah, I think definitely there needs to be some background slides, rational slides, and some strategy slides before we start talking about individual devices. The go bag itself can link to a comprehensive list, but we don't have to include all the elements in a go bag. I mean, that's the nice thing about electronic document is, that it can be a mention and then linked to greater information.
Yeah. So right now, we can switch over and I can share mine or if Aubriana wants to share the PowerPoint.
Oh,
You do that?
Yes. Is it the link that I shared with you, Dr. Rice? Or
Yeah.
Oh,
Yeah,
okay.
exactly.
Bear with
Yeah.
me.
So I right now only have like 15 slides in here. So I think that obviously some of these things like tracheostomies probably needs 3 slides or 4 slides.
Yeah.
Like some of these things need more slides, but these are just the topics here. And then if you guys want to add more, we can add more.
Can you see my screen?
Perfect.
Sign.
And then I'll kind of get out of the thing so you can kind of control this one, Jordana. Or Aubriana has got it.
Okay. Okay.
So that's kind of the end of it. And there's only about 12 slides, when you subtract the title stuff out. Only about 12 slides right now.
With the possible expansion on say slides 10 through 15.
Yeah,
So
yeah, I think all of those are going to need a slide with a picture, a slide with information.
okay.
This is where you could put any like equipment stuff. So if there's some equipment thing that's important about one of these things, we can have a slide about equipment related to.
Okay.
So I think most of these will need some expansion. And if we stick to these topics and expand appropriately, I think we hit probably that 45-minute lecture limit.
Okay.
And then,
Sorry, Dr. Rice, is that with 30 slides? Just to make sure that would hit the 45-minute mark with the 30.
you could probably go more. I mean, I think you have some wiggle room in here.
Yeah, once we start filling them in, I think some of them will expand a bit. Can we also put a learning objective slide early on?
Mm-hmm. And then we might want like a couple slides, like for each, like maybe 1 or 2 or 3 cases. Cases are always fun ways to make a point.
Okay.
Yeah, case scenarios are always helpful, I think, for the learner.
Yeah. So maybe at least 2 cases maybe throughout, like who knows how many, but at least a few.
And I have data like on that slide that's who are the children and youth with special health care needs. I have data of like estimates of like the number in Arizona, or we could give like
That would
just
be
kind of
cool.
broadly speaking, yeah, like 1 in 5 kids has a special health care need, and
Yeah, that's cool.
just to build that rationale. Okay.
And demographics, yeah, I like that. If you have any of that, that'd be great to add.
Just to again kind of drive home that like no matter where you work, you will likely come across like these kids.
Yeah.
Did we
Yeah.
also? Oh, sorry, Dr. Woolridge, please go.
No, I was just commenting. I agree. Definitely helpful to give the background, a couple of background slides and information like that.
I don't know how much of value this would be, but do we want to do something similar to Safe Sleep where we provide a resource slide for them to kind of defer off to for additional learning?
Mm-hmm.
Okay.
I totally agree, Aubriana, but commented on earlier, I mean, it's nice to not recreate the wheel. I mean, there's a lot of resources out there, and each slide could potentially have a link to greater information on resources available. Again, through shared resources, the EIAC was mentioned earlier. There's a lot out there that we can link to.
Yeah, I like that. Just keeping it slide specific. I think that's a good idea. Thank you. Okay, awesome.
And then I do think potentially, you know, and we could bring this back to the education committee, maybe. We haven't really talked much about educational modules for the critical care paramedics, which are it's a very new thing for the state, obviously. But I can see potentially creating a version of this that is more in depth for the critical care side. So paramedics that actually might need to be transporting ventilated patients or doing some of these things in rural hospitals that it might be helpful to have. So I think we can put this on the agenda for the next education committee also and see if they feel like there would be an interest in also creating a version of this that does contain the more advanced material for sort of beyond the field provider.
And I hate to keep repeating myself, but I am really the king at not recreating things that have already been done. So the Apples program that was put together by the AAP and ACEP is non-proprietary because it was grant funded, and they have like 100-slide lecture set on children with healthcare needs.
Oh wow!
It's dated, but I'm sure there's some things that ideas we can get out of it.
Yeah,
I'll dig it up. I'm not at my office computer, but I'll dig it up and share it with the group.
Yeah. So Aubriana, is this something that I did talk to Dr. Munn today also, because she had to start a shift at 2:00, but is very interested in working on this project. So said, please fill me in on what's next. So I think maybe this is something that we can continue to fill some stuff in, and then maybe schedule another time to go over at least just this initial training. What do you think, Aubriana?
Yeah, I think that would be great. Thank you, Dr. Rice, for that recommendation. And if anyone else wants to invite more people to the group, please feel free to do so. But yeah, I will send out a doodle poll, or I'll work with Shelly to try and get some dates for everyone for our next meeting. But I'll share the links in the meantime, as well as the reference document, so you can just use the information there if you'd like.
Perfect. And then do you have folks, Aubriana, that you specifically want to work on filling in these slides? Or do you want to assign any of that out now?
We are at the top of the hour. Oh wait, actually, yeah, this ends in 2 minutes, right?
I scheduled it for 1.5.
You are the best, Shelly. Thank you. Okay, I just checked my calendar again. Apologies, everyone. Yeah, I think that would be great, Dr. Rice, if people want to volunteer now to work on some slides. If not, I do think case scenarios should be deferred to the physicians on the call. And then the remainder, if people want to volunteer, that would be great.
Dale, do you want me to have Rachel draft up a couple cases? And she has a bunch already from training. She probably has some special healthcare ones. I could have her send some to the group.
Oh, that'd be awesome. Be amazing. Absolutely.
I told Rachel she was good at science.
Let's poll the attendees right now and ask which slides they want to work on, and then we can get some assignments going.
Yeah, perfect.
I was about to volunteer myself for the data slide. I can do that. I can do that one. Do you want me to just tag myself in it, Shelly, or how do you? Yeah, okay.
That's a good idea, because I always forget what I signed myself up for.
Totally.
Like, oh.
That's what I was like for future Allison to remember.
Yeah, that's a good idea to just put the names in the slides.
Can I, is it okay if I work on the case scenarios with Rachel, and then I can hover over other slides and offer any suggestions?
That would be perfect.
I can
And
do
I'm
the
open to
tricks.
working on any of
Sorry.
them. Go ahead, Gwen.
Go ahead, Jordana.
I was just saying I'd be more than happy to work on any of them. So whatever needs to be worked on, I'm happy to help.
Thank you, Jordana.
If you guys don't mind, I'll do what I know. Tricks.
Dana, do you want to do the go bag slide?
Yeah, I can do that.
Okay. Let's put your name up. Do we have a volunteer for the equipment slide?
I can do that one, but
Okay.
I can do a couple more if you guys want.
This is fairly out of my wheelhouse, so.
This may be an offlandish thought, but did we want a disaster preparedness slide in there for children with special healthcare needs? Is that pertinent to this presentation, or do we want to do a separate one for that?
What would be in there?
I don't know. I just know there's, Deb, do you have any recommendations on that from your expertise?
Well, I mean, I do. It's just separate from tracheostomy or anything. It's, but I'm not sure it's right for this committee. So I mean, I understand in the expertise of this committee, and I wish it would focus on, you know, mass casualty incident response, but, you know, I don't know that you, that this would be the proper place. I don't know.
No, thank you, Deb. I appreciate it. It was just a thought that I had because I know it's a conversation, especially with transport with the family and such. But that may be a different slide deck in its entirety.
Right. There are a whole bunch of things that we're working on pertaining to pediatrics, but I think that it might be outside of the scope of this group.
Got it.
Thank you, guys.
All right. Glenn, you're our respiratory tech. Should I assign you to the trach?
I'll do the trach.
Shelley, do you want to start at the top of them so we can go through and each one so we know which ones have been assigned, which ones haven't?
Okay.
Sorry.
Adriana, are they showing up?
Yeah.
Is my
Yeah, I
typing-
apologize. I was bouncing all over. Apologies. Coffee brain. So learning objective slide. Do we have somebody for that?
We can just do it at the end, probably, once we.
Okay.
With the content.
Okay, case scenarios is Dr. Woolridge and Dr. Munn. Children with special health care needs. Allison, do you want to do that one with me?
Sure. Although I was wondering, is there anything we need to add, or is that kind of, I mean, we can obviously like
I don't think so. I feel like that slide's
think about
Done.
formatting or something, but yeah, like I think like content wise, that about covers it.
okay. Awesome. Okay, so Allison is data slide, parents and or caretakers. Do we want Dawn and Jordana? Do you want to take responsibility of this slide?
Yeah, Dawn's not on here, but I would be more than happy to work with her on it.
Thank you.
I thought I saw her jump on at one point.
She wasn't. I think she had something else that she had to hop off.
Oh, got it. Okay.
Baseline vitals. I have the information in my document, so I can do this one as long as I have an overview from,
Aubriana can help you with that for sure.
thank you, Adam.
And Ariana, I know that Dawn has some opinions on that one. If you're, so you can always run it past her also if you want her inputs.
Yeah, that would be great. Thank you. Medical history. I don't mind doing that one as well.
Yeah, I was gonna say I can help you.
Okay, equipment is going to be Glenn. We have Jordana doing the go bag. transport and facility selection. I think I can do that one.
I can also help with that, Aubriana.
Thank you, Jordana. Trach is Glenn, and then we have indwelling lines.
Does anyone mind if I move slide 12, the equipment down? So that it's like medical history, go bag, transport, and then it goes into that full equipment.
Oh, yeah. Yeah, totally.
Blah, blah, blah. Okay.
I sort of put them in like just as I was reading the document. So
Yeah, and in the document, it's like that, and then it goes later
Yeah.
on into that deeper detail, but I think in a training, maybe that flow works better.
Aubriana, is there stuff to cut and paste for indwelling?
Yes, just needs review. Anyone for feeding tubes?
I can do those, Jordana.
And then VP shunt.
I can do that one too.
And gastric and urinary catheters.
Yeah. So cut and paste material.
Yeah, I'm gonna need help with that one though.
I can help you, Aubriana, whenever you need.
Thank you.
I almost think we could do like this training and then finish what you're doing. I'm jumping in with a suggestion while you're in the middle of something. I'll wait.
No, that's okay. Neurodiverse children. I would like to do this one as well.
Yeah.
And that concludes. Okay, Dr. Rice.
Oh, perfect. So just looking at the different topics, because obviously we're going to kind of cut a lot of the medical stuff a little short so that it's deliverable within, the hour. So, I think potentially we could do like a expanded hour on some of all the other medical stuff. Potentially, I don't know where you guys want to go with it, but there could be like a deeper dive medical one or something like that. That might be kind of interesting. Just trying to think of how we deliver it where it's going to get used. I don't want to make a training that no one will download. I want lots of people to use it. So maybe something to think about for our next time.
I know a common concern in our organization is the ventilators. I know a lot of people are really terrified of those things. And most kids that are on tracheostomy are on ventilators. So if we can put those two together, I'll create something. It won't be long. It's just what to do, what not to do, whatever. And if you guys have a case study on it, if the case study comes up right away, then I can focus on what your guys' points on your case study is.
Yeah.
Because I don't, like I said, I don't want to, if this could be something that can be really extensive, but we want to keep it as short as possible, right? So maybe I'll work off of a case study. If you guys put a case study up on a ventilator or a vent-dependent patient that has a VP shunt.
Yeah.
Is there anyone on the call that cannot work with the Google Slides? Do they need a PowerPoint version? Conversion? Okay, cool.
Would someone just came to mind, would we consider, and forgive me if it's already there, a slide on behavioral health, behavioral health, combative patients, autism spectrum, that kind of idea?
Yeah, I think with the neurodiverse one, Dale, that would be a really good idea to go with that one.
Okay.
I like that idea.
And
I
I've
think
been,
one of the things that we get a lot of calls at the base hospital on related to children like this are calls for things like sedation. So I think specifically addressing that potentially, that may be a Dale question, like a sort of a Dale slide, but sort of how you approach and, you know, we really tend not to try not to sedate these children. So I think sort of speaking to
Right.
that maybe would be an important one. We do get a lot of calls on that kind of stuff.
Okay.
Because they just don't know what to do. They're like, they're 7, but they're losing it, you know?
yeah,
Right.
we would also, I mean, I would say I would also advocate for trying to emphasize that sedation is definitely not your maybe first, second, or even third choice. And that this is where maybe partnering with the parents is a really good strategy to help calm. I mean, I think some of those like practical strategies that could, I was also going to say, I've been seeing and is where I wish Dawn was on the call, but we can follow up. I have been seeing a number of like community training, different things go past in my inbox around this. So maybe this would be another, just a good place to kind of put that plug that like, maybe very generally, because they might be very localized, like region specific, but just that there may be training available in your community from some community organization on this, like some autism group or somebody else who might be willing to come in and like work with your team on how to interact with this population.
Yeah.
There are actually a couple here that do that. There, Gilbert Fire and Gilbert Police actually have a big, huge thing where they help with autism and they train all their staff. So something like that, maybe just putting the links for those different organizations might be a helpful tool to put on there.
Yeah, that's what I was thinking, Jordana. And what is this one that's like Preston's something? I think it's Preston. No, I'll look. I'll find it.
Yeah, Preston, I actually have a card for the owner, founder of it. So we could also put their information on there as well. They help a lot with Gilbert as well.
Okay. And then I think for any folks who are like outside of the valley, outside of Maricopa County, I don't know if I don't totally know if there's resources out in some of those other communities, but maybe there are. Maybe there's local autism societies and stuff that are doing something.
Yeah. Yeah, I think those are all really good suggestions.
Okay. Awesome. Well, now that we have kind of an overview of what we're going to contribute for content, when would we like to have the next meeting? Would you prefer a poll to go out for dates, or do we want to come up with a date while we're all here?
Maybe send a poll. I don't know. What do you think, Shelley? Only because that way we can include Gail and, you know, other folks that aren't on the call.
Do you think we'll have a draft product ready by the March 20th meeting date?
If we meet sometime in February, yeah. If like maybe towards the like endish of February, give people time.
Okay.
That would give us like a week after that, right? Or 2.
Where's the time going? Yes.
Yeah.
Do you want to give me dates, or do you want me to pick dates and times?
I think it should revolve around Dale and Rachel also. Because I definitely want them available, probably more than me, but
Well, send an email.
Yeah.
Asking. Okay.
Yeah, I need Dale.
Okay, excellent. Well, just opening the floor again, is there any questions, comments, concerns from the work group before we close out?
No, Aubriana, thank you so much.
Yeah, well, thank you all for dedicating the time, and I'm really excited to work on this project with you, and we'll meet again soon.
Thanks.
Awesome.
Great. Thank you, everybody.
See you guys.
Bye.
Bye.